Gingivitis is a bacterial disease that can be followed by symptoms that vary according to its causes. Inflammation and gum bleeding are some of the symptoms that may happen. Having gum inflammation can be a precursor to periodontal disease because if not treated, it tends to keep progressing until it reaches and destroys the periodontal ligament and the alveolar bone that involves and sustains the teeth, support tissues, and can even lead to tooth loss in more advanced cases. This issue deserves a lot of care and attention. Do you suffer from gingivitis or know someone who does? According to the health ministry of many countries, oral health is an integral part of general health. Did you know that? Some say that gingivitis can be related to heart issues. There is a theory that gingivitis allows bacteria to enter the blood flow, where they adhere to the fat deposits in the blood vessels. It can cause clots and heart issues, so taking care of your oral health is an essential step for having good health. But how can you know if you suffer from gingivitis? Of course, an evaluation by a dentist is essential, but gingivitis has some very specific symptoms, such as toothache, sensitive and loose teeth. Some may even fall, bleeding, white plaque on gums, redness, and bad breath. When someone has tooth loss, it means gingivitis is already well advanced. The ideal is to treat it at the first signs, especially when bleeding happens. To have perfect oral health, you need to keep your mouth healthy. It means brushing teeth, flossing daily, and visiting the dentist regularly. Many people say that using hydrogen peroxide can help sanitize the mouth and avoid gum issues. Do you want to know how? To prepare the liquid that you will use to rinse your mouth, just mix 1/4 of water with 0.33 ounces of 10-volume hydrogen peroxide. However, rinsing your mouth with hydrogen peroxide will only be effective if you do it after brushing and flossing your teeth. Besides that, do this rinsing only once a day for up to 10 days. According to the experts, this kind of rinsing is recommended and even beneficial in some cases. When done as recommended, it doesn't cause any harm, but it is important to follow the directions, such as proportions of dilution, number of times per day, and per week. Besides that, you should not do it every time you brush, only once every 8 hours. It is important to note that, at any sign of irritation or allergic reaction, the treatment must be suspended immediately. It is also worth noting that hydrogen peroxide must be diluted when you are doing the rinse, and you must use a sterilized measurement cup. If you like the video, give it a thumbs up and share it with your friends. For more recipes and tips, subscribe to the channel.